Today we will talk about 9 symptoms of death. Before starting, do not forget to subscribe to the channel if you like the video. The death of a person with a disease that leads to it is preceded by the emergence of many symptoms and signs that indicate its approaching term, and in what follows an explanation of the most prominent of these signs and symptoms. 1. Loss of appetite. Death is usually preceded by a general weakness in a person's activity, which reduces his appetite and need to eat as a result of a decrease in his need for energy. A person may also stop eating completely in his last period before death, and then his lips must be continuously moistened so as not to cause him discomfort when they dry out. 2. Increased sleep hours. This is due to a decrease in the effectiveness of metabolism and the energy resulting from it in the human body, and an increase in sleep is usually noticed before death for a period of between 2 and 3 months. It is necessary to encourage the patient to move, and to make sure that his bed is comfortable for sleep. 3. Lack of social interaction. This is due to the lack of energy in the body as well, so the person tends to stay at home and not mix with those around him. It is the duty of these persons to arrange visits so that he does not remain alone for long periods of time before his death. 4. Change in vital signs. A person who is about to die may suffer from a drop in blood pressure, or disturbances in the heartbeat, and these pulses may become unclear when heard, and the color of urine may change to become brownish, which may be a sign of weakness of the kidneys and stop working. 5. Changes in excretory habits. We mentioned previously that the quantities of food and liquids may decrease in the near-death human body, thus leading to a lack of need for excretion and urination as before, and this process may stop permanently if the person stops eating and drinking completely. 6. Muscle weakness. The approaching death of a person sometimes accompanies the suffering of general muscle weakness, which may prevent him from performing the simplest activities, such as lifting small objects or turning over the bed. 7. Low body temperature. This is due to poor blood circulation, and its focus on the important internal organs rather than the whole body, which causes coldness of the limbs, pale skin color, or the appearance of blue or pink spots on it. It is worth noting that the patient may not feel this cold, and therefore care must be taken to warm his body with appropriate means. 8. Confusion of the mind. Some people may suffer before their death from a confusion of the mind and a weakness in the connection of ideas they have, and they may lose focus and awareness of what is happening around them. 9. Respiratory disturbance. The patient may experience sudden changes in the respiratory rate, so that the respiratory rate becomes rapid or is interrupted by some stops. Increased pain and the sounds accompanying it can increase when a person nears death, and a doctor should be consulted about the need to give him medicines or painkillers. Hallucinations. A person may suffer from hallucinations and distorted fantasies prior to his death, and it is better for those around him not to correct what he says, because of this negative impact on his psyche.